Welcome, everyone. Bienvenidos. Buenos dias. Welcome to today's meeting of the Public Health Work Group of the California Climate Action Team. Thank you so much for being here today and for joining us. My name is Abigail Ramirez, and I am with the California Department of Public Health's Climate Change and Health Equity section. Before we start, I want to provide some instructions for turning on simultaneous interpretation for our Spanish-speaking attendees. To turn on simultaneous interpretation, please find the globe icon at the bottom of the Zoom screen and select your preferred language. You can see that on the yellow arrow provided. The mute original audio option will turn off the overlay of voices for a clearer sound. Please see the red arrow. So if you hear more than one voice, please click the globe icon and then click English and then mute the original audio. Please note, if you don't see the globe icon at the bottom, your Zoom software may need updating in order to take advantage of the interpretation functions. And now I will be transitioning to Spanish to provide these instructions in Spanish. Bienvenidos, gracias por estar aquí con nosotros. Bienvenidos a la reunión de hoy del Grupo de Trabajo de Salud Pública del Equipo de Acción Climática de California. Gracias por acompañarnos. Mi nombre es Abigail Ramírez y trabajo en la sección de Cambio Climático y Equidad en la Salud del Departamento de Salud Pública de California. Antes de comenzar, voy a dar instrucciones sobre cómo activar la interpretación simultánea para los que necesiten interpretación en español. Para activar la interpretación simultánea, busque el símbolo del globo en la parte de abajo de la pantalla de Zoom y seleccione su idioma preferido. Por favor, mire la flecha amarilla para más información. La opción silenciar el audio original desactivará la sobreposición de voces para un sonido más claro. Puede mirar la flecha roja para más información. I will also like to point out, if you have additional comments or need additional instructions of how to identify the interpretation, feel free to just include it in the chat and we'll be able to provide you with more details. Si necesita más información sobre cómo seleccionar estas interpretaciones, este servicio, por favor ponga sus comentarios en la área de chat y nosotros le vamos a responder. Muchísimas gracias. And now I'll turn it over to my colleague Trinity Smith. Next slide, please.
Thank you, Abby, for those instructions, and welcome again, everyone. Today's meeting is co-hosted by the California Department of Public Health, or CDPH, and the California Air Resources Board. Our public health work group meetings are designed to provide a forum for public health partners and other stakeholders to learn about and discuss timely issues at the intersection of climate change and health equity. My name is Trinity Smith. I use she, her pronouns, and I am speaking to you from traditional Concow or Northwestern Maidu land. I serve as the Health Program and Policy Specialist for the CDPH Climate Change and Health Equity section. I'm joined today by Dan Wu, our team lead, and Linda Helland, our chief of the Climate Change and Health Equity section. At CDPH, we work to assure that California's actions to prevent and prepare for climate change improve health, equity, and resiliency. Our mission is to build health equity, improve living conditions, and advance climate action through policies, systems, and environmental changes. Today's presentation will center on lessons from our COVID equity response and recovery efforts that can be applied to addressing the climate crisis. Before we get started with that, we do have a few additional housekeeping items. So next slide, please. So in addition to interpretation services, real captions are being provided today by real-time captions are being provided by eCaptions. You can find the closed caption feature along the bottom of your screen. And you can see on the slide there, it should be between record and reactions. So if you click on that, it should let you start closed captioning. With that, we'd like to remind all presenters to please speak clearly and at a measured pace for our captioners and interpreters. For this meeting, we've muted all attendees, but we do encourage you to submit any questions you have through the chat feature, which you can also find along the bottom Zoom controls bar for your screen. And we also ask that everyone turn off your videos unless you are presenting to help with viewing for everyone. And we believe that the best way to view the speaker's videos during presentations will be if you go up to the right-hand corner of your Zoom screen. There should be a view icon. If you click on that and select the side-by-side and then gallery view, that should allow you to see the speakers when they're presenting. Next slide, please. And this meeting will be recorded as well and should be posted online about a week after the meeting. It can be found at this link, and we will also be posting this link in the chat, so you can keep track of the link and check or share this with others so they can view the recording. So that's all the housekeeping. So I will now turn it over to Linda to provide some introductory comments.
Thanks so much, Trinity. Good morning, everyone. I want to thank our team that organized today's event, especially Dan Wu, Trinity Smith, and Amanda Hooker. Over the past 22 months, we've seen widespread disruption to virtually all economic sectors, affecting our access to household supplies and food, healthcare services, our ability to travel, and more. The pandemic exacerbated existing inequities, whether around the lack of affordable housing, job insecurity, gaps in worker protections, and the worsening of wealth inequality. Links between environmental justice communities that have long been exposed to greater levels of air and other pollution, to increased susceptibility to respiratory impacts from COVID. All while climate change continues to impact communities. We saw record-breaking temperatures and heat waves, devastating wildfires and smoke, severe drought conditions that then swung into historic deluges in parts of the state. And also during these past 2 years, we saw continued reckoning of historic and current racial injustices, the structural racism baked into our systems, institutions, and policies that drive racial and health inequities, the extraction and exploitation of natural resources and people, and carbon pollution that fuels the climate crisis. And we also saw innovative solutions, often led by Black, Indigenous, and other communities of color. We saw the implementation of strategies to create or expand worker protections and to prevent evictions, the expansion of community-based food access, the closure of streets to cars, to prioritize slow streets for safe and socially distant walking and cycling, implementation of an equity framework to prioritize resources for communities facing inequities, and an acknowledgement of structural racism to begin to right some historical wrongs. We have a long way to go, but many of these strategies can also provide climate resiliency and health benefits. Today, we'll hear examples of these types of efforts. Rohan Radhakrishna will talk about state COVID-19 equity efforts, including the importance of addressing structural racism as a root cause for both COVID and climate health inequities. We'll hear about local examples of community resilience from Hazel Davalos and Hoife Mak through their respective efforts around worker protections, disability justice, mutual aid, and more. Angie Hacker and Shasta Gahn will share their work around increasing COVID and climate resilience with tribes. We'll have a short break before hearing from Savannah North and Matt Vanderslice and Dan Petticourt about their respective work and lessons from the local and regional public health perspectives. We hope to shine a light on solutions and examples for advancing equity and community resilience to not only viral threats, but also climate-related impacts. Before we introduce our first speaker, I want to turn it over to my colleague and co-host from CARB, Bonnie Holmes-Jen, Chief of the Health Exposure and Assessment Branch, who will provide a brief update on their research on COVID, air quality, and health. Thank you.
Okay. All right. Can everybody hear me now? Yes. And can you see me?
Yes.
Okay. Apologies. Thank you so much, Linda. CARB has a deep interest, and I think I do have one slide to throw up here. CARB has a deep interest in understanding the relationships between air pollution and COVID-19 and building on research that has been going on around the world, in the US and around the world on this topic. And I wanted to highlight briefly two contracts that we entered into a little over a year ago to better understand these impacts. One is led by a team from UCLA and the other by UCSF. And the UCSF study is partnering also with Public Health Institute. I know Paul English is a regular participant on these calls. And we're close to getting results we can share with the public. We expect to receive final reports in December. And I wanted to say out of the box that we greatly appreciate the partnership with CDPH, and that CDPH was able to help our researchers access statewide COVID data on our statewide project. It was much appreciated. The studies are very well designed studies and will provide important advances. I wanted to just quickly go over some attributes of both studies, starting with the UCSF study on the left. This is a statewide study that will provide the first large-scale sub-county assessment of COVID-19 incidence and mortality and its association with PM2.5 pollution. We're using an extremely large amount of data in this study of COVID cases and deaths, looking at over 3.5 million records from the CDPH database over about a 1-year period. And also looking at PM2.5 long-term average pollution from about 2000 to 2018 at the census block level. This study includes an ethnically and geographically diverse population around our state, and obviously varied range of long-term PM2.5 exposures. It's very refined level of analysis, probably the most refined for any COVID-19 air pollution study to date. And this will provide us really important information. It is drawing from, again, extremely large number of COVID cases, and will help us assess the risk of COVID-19 incidence and death in vulnerable communities that are highly impacted by pollution sources. The Southern California COVID-19 contract with UCLA, that's pictured on the left, this is utilizing Kaiser Permanente data in Southern California. Also provides a very refined level of geographic analysis. This is covering data of over 300,000 COVID patients in Southern California region. All patients that were tested or diagnosed with COVID over a 1-year period. And the study focuses on a broader set of pollutants, looking at ozone, NO2, particle pollution, PM2.5, and ultrafine particle pollution. And this Kaiser Southern California data allows us to focus on more individual factors and comorbidities, including smoking, and BMI, other individual factors that might affect COVID impacts. And this study allows us to look at the severity of COVID illness, in addition to just the number of cases and deaths. Because the Kaiser data is more detailed, we can look at hospitalizations, worsening of illness indicated by intensive care unit admissions, as well as discharges and deaths. So that's just a quick overview of the differences in the two studies. The results from these studies will give us the strength of association of COVID cases and deaths in California with long-term air pollution exposures on a statewide basis. And of course, one study is more focused on PM 2.5, the other includes multiple pollutants. We'll understand the risks of COVID-19 infection and mortality related to racial and ethnic population data. So we'll have a window into how air pollution and COVID are related at, again, a neighborhood level, and specifically be able to look at racial and ethnic factors. The Southern California study, again, will give us more specific data linked to a number of air pollutants in COVID-19. While we're still awaiting the final reports, we're very pleased with these studies and insights they will be providing into the broader health impacts of air pollution on our communities, especially under-resourced communities. We believe these results will demonstrate clearly how important reducing pollution exposure is to reducing disease vulnerability and maintaining health, especially in under-resourced communities. We'd like to report back to the group when we have publicly available results to share. So we'll make sure that we plan that at a future meeting. And I'd like to particularly thank many participants of this group who have been involved in these studies, particularly Dr. John Balmes and Dr. Paul English, who are regular participants in this discussion. Thanks so much, Linda, and I'll turn it back to you.
Thanks, Bonnie. And now Dan Wu, team lead with the CDPH Climate Change and Health Equity section, will introduce our speakers.
Great. Thank you, Linda. Thank you, Bonnie. So it's my pleasure to introduce our first speaker. Dr. Rohan Radhakrishna was appointed by Governor Newsom in early 2021 to lead the California Department of Public Health's Office of Health Equity, which includes the Climate Change and Health Equity section. He also serves as the department's Chief Equity Officer and Tribal Liaison. He brings multiple decades of experience working with impacted communities and previously served as co-chair of the statewide Health Equity Committee for the California Conference of Local Health Officers. Rohan spent 10 years at a local health department, most recently as deputy health officer in Contra Costa County. His local experience responding to the COVID-19 pandemic, power shutoffs, wildfire smoke, and heat emergencies has solidified his commitment to addressing the overlapping public health crises of climate change and structural racism. Take it away, Rohan.
Buenos dias. First of all, thank you to Pat, Marlene, and Giovanna, our ASL and Spanish interpreters. Thanks to Abigail, Trinity, Dan, Linda, Amanda, and our colleagues and staff within the Climate Change and Health Equity section and at the California Air Resources Board. And thank you to all our amazing panelists and participants, 174 and counting. My name is Rohan, my pronouns are he, him, and I'm speaking from the traditional lands of the Muwekma and Ohlone people. As a family doctor and public health practitioner, with 20 years learning from impacted communities, both global and within California, I'm clear that supporting the pandemic response at the local and state level has taught us there is no health or climate justice without racial justice. The syndemic, or the simultaneous overlapping crises of structural racism, socioeconomic inequality, the climate crisis, and now COVID-19, they all have related causes. They have effect multipliers that research will continue to show the strength of the associations. And they have related joint solutions, where I'd like to focus today. Cross-sector planning and implementation of a CHE, climate, health, and equity in all policies and decisions is the only viable way forward. Just as every policy and program goes through rigorous pressure testing and analysis from the Department of Finance, every policy and program here forward must be analyzed first through a racial equity lens, and second, must consider climate, health, and equity impact assessments. Next slide. I can't breathe among the last words uttered by George Floyd and Eric Gardner came to be a global rallying cry for racial justice. I can't breathe implies shortness of breath and the need for respirators and ventilators that COVID-19 has brought us. I can't breathe describes environmental injustices and disproportionate impacts from redlining and historic structural governmental discrimination and racism. That means more air pollution for communities of color, higher asthma rates. Globally speaking, I can't breathe connotes the loss of biodiversity, deforestation, and the unrelenting release of carbon pollution driving the climate crisis, which has been described by our UN Secretary General as a code red for humanity. As a doctor who's responded to code blues where patients can't breathe, it's time to center and elevate the health voice and perspective in the climate crisis and to name a code blue for humanity. For 2 years, we have faced the overlapping public health crises of COVID-19 and climate change. Over 73,000 Californians have lost their lives, 1 in 550. 52 more are likely to die today from the virus. This is a moment of societal grief from COVID, as well as climate grief and anxiety for the disproportionate burdens to come. And even though vaccines have helped us in our fight and will help us get through this pandemic, we will see lasting changes. But when it comes to climate change, there is no vaccine. As Linda mentioned, we've seen record-breaking wildfires, towns and communities incinerated, smoke affecting most all of us across the state, the highest daily temperature reading of 130 degrees in Death Valley, and the back and forth between drought and atmospheric rivers. Both COVID and climate change have seen unequal impacts of communities already facing inequities and has exposed the underlying systemic injustices across the spectrum of our economy and society. This is not a new realization that Black, Indigenous, and people of color communities have long seen through structural racism, where highways are built, where home loans were denied, where factories are zoned, where asthma rates are higher, where COVID case rates and mortality burden is greater, is not a coincidence, the overlap. What is clear is that we cannot achieve health justice or climate justice without racial justice. Next slide. This is state California CDPH data showing in 2020 on the y-axis, the percent increase. To me, inequity at its worst is disproportionate death. Inequity by definition is unfair, unjust, and preventable. And we see that those social and structural determinants of health drive the disproportionality. Limited English proficiency on the top. The digital divide was deadly in the Sonoma fires. It was non-English speakers and the elderly who died the most. Housing overcrowded in the middle led to the same disproportionalities when our state was founded during the gold rush era, and 9 out of 10 died due to unsafe housing, living, and working conditions, including crowded housing. Not a lot has changed in 150 years. And in the bottom, poverty. But what's worse on the right side is you see almost the dose response as you increase the toxin, you increase the harm, as you increase the housing crowdedness or the poverty, you increase the percent of disproportionate death. This is overall, not just COVID death. And worse in communities of color. Black, Asian, Native, Hawaiian, Pacific Islander, tribal, and worst hit Latinos on the far right. Next slide. Why during a global pandemic would your California State Health Officer and Public Health Director, my boss, Director Tomas Aragon, name equity and anti-racism as a top priority? It's because he's a doctor of medicine and public health and he understands root causes. That chronic stress and racism are root causes of the disproportionate access to resources, differential living conditions, which set the stage for disproportionate COVID risk and climate risk. Chronic stress throughout a life course ends up affecting generations through epigenetics, increased allostatic load, multiple organ systems, and disease and processes in the endocrine and cardiovascular system engaged, leading to more disproportionate disease and risk. Next slide. The Bar-High model shows a variety of these upstream social factors and structural factors that increase COVID risk and increase climate vulnerabilities. How do we build the protective factors to build resiliency, to weather the storm of recovery from this pandemic, prepare for the next one, and prepare for the ongoing onslaught of climate-related disasters? Moving upstream to address the PSE or policy systems and environmental challenges through that climate, health, and equities in all policies approach will help level the playing field. Next slide. But it's important to take an intentional anti-racist lens to our work around COVID and our work around promoting climate resiliency. Ibram Kendi, who will be speaking in the Sacramento area early next year, tells us that racist policies lead to racist ideas, not the other way around. That we got ourselves in this mess and government is part of the problem, but we can also be part of the solution. And that a culture of justice and health equity flows from policies of justice and health equity at the state and local level. The Institute of Medicine defines public health as a society, what we do to create the conditions in which people can be healthy. This is to weather the storm of a viral pandemic or of ongoing climate crises. Next slide. So how have we and how will we operationalize equity for a California for all? There's a variety of mechanisms that have already been crisis tested. Prioritized financial incentives, investments, resources, higher levels of service, facilities, capacity building, jobs, and ultimately decision-making power. Or as Genoveva Islas says, cash, capacity, and control. We've already done this in California with climate funding, with our climate investment program, where 35% goes to prioritize disadvantaged or low-income communities. We can continue to match this to the disproportionate burden, as we have done with COVID, tracking test positivity, case rates, and mortality, and deciding what REISs go where, when, whether it's a mobile clinic, vaccine providers coming on board, distributing initially scarce resources. Next slide. The California Healthy Places Index, created by the Public Health Alliance of Southern California in partnership with the Public Health Institute, partners including from our office, has been a very important tool. At the federal level, you may hear the CDC's SVI or Social Vulnerability Index, but we prefer this asset-based tool based around policy areas that is tested to indicate life expectancy at birth and gets down to the census tract level with 25 sociodemographic variables. We have used this throughout the pandemic, from the early days of our blueprint for a safer economy, to our health equity metric, to looking at test positivity and how we would not leave a particular census tract or neighborhood behind when a county was considering reopening. We've used it to distribute resources, being first in the nation to technically double down and put double the vaccine allotment to the lowest quartile, the bottom 25% of the least healthy neighborhoods, that quartile 1. We have a governor who wakes up thinking about quartile 1 and those historically red-lined lower income communities of color with the disproportionate burden, and looking at our vaccine equity for adults and now for kids in those areas. We used this tool in November to initially distribute 5 to 11-year-old vaccines, and we'll be using it in December to distribute antiviral medications for coronavirus as they come on board. We've used this for over $1 billion of cross-sector state funds and grants disbursement, again, to try and green line historically redlined areas, but to use a scientific-based approach to right our wrongs from the past. Next slide. So, public health can play a powerful role in messaging, not just during the COVID crisis, but also during the climate crisis, and can bolster climate action, health, and equity. 68% of Americans, according to Eco America, trust health professionals for information on climate change. Although many of my colleagues have come under threats of harassment, some have retired early, been forced out of their positions for championing science and data and safety, the public still trusts public health professionals. And in fact, they care about their health when it comes to climate change and climate solutions, even more than jobs. Local health departments are eager, and for the third year, the California Conference of Local Health Officers has made climate change one of their top 3 priorities for 2022. At the UN COP and at the federal health and human service agencies, we've seen health and equity being elevated. I'm just back from Washington, where I met with the new Office of Climate Change and Health Equity at our Federal Health and Human Services Agency, again, aiming to center and elevate health and equity. Next slide. We've harvested a variety of tools that we've used during the pandemic to promote equity, and some can be used for the climate crisis as well. Here you see from our playbook, which came out a year ago, last December, with bulletins every couple months, that an equitable response and recovery to COVID-19 requires a comprehensive, all of government and multi-sectoral approach. And the same is true for the climate crisis. Please take a look, and maybe we should make a climate bulletin version of the playbook to literally translate the lessons learned. And please include them in the chat as you're thinking of lessons learned from the COVID response from your vantage point at the community, tribal, or local level, and how it can inform our climate work. Put those into the chat now so we can continue to harvest and share. Next slide. There are a variety of lessons from the pandemic for climate and health equity. The interconnectedness of planetary health and people's health, and the humbling reminder of a communicable disease tells us that we are all only as safe and healthy as our neighbors. A virus or a wildfire or particulate matter crosses boundaries, crosses zip codes and census tracts, and can affect all of us. We know that we cannot rely necessarily on the private sector, and that structural change in government planning at the state and local level are essential. We know that public health infrastructure is critical to this, being chronically underfunded and under-resourced. Now we are using flexible federal funds to build a corpus of equity officers at the state and local level embedded within health departments and county government. We are employing health impact assessments and data modeling to show where we need to invest to prepare resiliency and improve adaptive capacity for the current and future threats. We need to champion prevention, noting its strong return on investment, that resources upfront can save lives, suffering, and money. And we've learned that there is no shortage of economic resources when a crisis is at hand, and we widely understand the threat. We developed mRNA vaccines at a safe and effective but breakneck speed, thanks to all the funding. Similar funding, not just for infrastructure, but for people and for human health and for building resiliency, as well as adaptation and mitigation, can make a difference. Policy decisions and actions must be based on science and evidence. And mutual aid, as you'll hear about later from other speakers, has been an inspiring form of the youth helping elders, neighborhood to neighborhood support, and speaking up and out for those who are incarcerated or detained. These networks will serve people well in future climate-related disasters as well. But we know that the strategies that reduce inequities and improve living conditions to improve community capacity and resilience are similar for COVID-19 and climate change. Next slide. Please read this article from Ed Yong in The Atlantic from September, who sadly reminds us that we are already barreling towards the next pandemic. Climate change will cause the migration of vectors like mosquitoes, of humans, and of viruses. It will be sooner than a century before we see our next one. And the actions of today are already writing the opening chapters of the next pandemic's history. We've been stuck in a 3-century Sisyphean cycle of panic and neglect that we have to get out of. If we do not turn these lemons into lemonade, shame on us. And as you see, inequity reduction is not a side quest. It is the central pillar of our pandemic response. And so if not for moral reasons, then for basic epidemiological ones, we must protect each other from the COVID and the climate crisis, because our inequality makes me and you vulnerable to both. So to be ready for the next pandemic, we have to even the footing in our societal structures. That means measuring preparedness with paid sick leave, safe and affordable public housing, food assistance, and universal health care. Equity has to be at the heart of what we do in this pandemic and in our recovery. Next. So this infographic from the Skoll Foundation summarizes a lot, that whether it is mitigation or adaptation or resiliency, we have to center racial and health equity. We have to lead boldly in a way that we haven't before. And we will not go back to normal, because normal didn't work. It was an uneven playing field, and we saw the disproportionate burden with COVID, and we'll see it with climate, as we've seen with heat already. We know in Fresno County that Black and Latinos are 8.5 and 4.5 times more likely to live in places with impervious surfaces, less tree canopy, increasing the risk of floods and extreme heat. We have to bounce forward, as the Movement Strategy Center implores us to do, from this and from future disasters. And that means redistributing power and resources towards a renewable, sustainable economy with inclusive participation in the policies that affect people's daily lives. Next slide. So to summarize, COVID-19 lessons for the climate crisis are that it's not just about the infrastructure. We have to remember the humans, that disproportionate death, that grief that we're feeling now and will feel in the future requires prioritizing investments to those who are hit the first and hit the worst. In 2015, Governor Brown issued Executive Order B3015 as an example of preparing for a resilient California, requiring the participation of impacted populations. We can continue this in all of our decision-making at the state and local level. And that requires, second, to use a PSE, or policy systems and environmental approach, that champions CHE, climate, health, and equity. You can't spell CHE without the H in the center. It has to be centered and elevated in all policies. Public health can champion the primary prevention, the most cost-effective way to address root causes of inequitable living conditions. And we can build resiliency through racial and health equity. An example is low-income weatherized homes that are affordable and climate resilient in historically redlined communities. That's something that can help us, because global heating will overwhelm some of our attempts at adaptation, and we must also advance community resiliency. Last slide. Ring around the rosy, a red rash from an ulcerated skin lesion from the Bacillus bubonic plague. Pockets full of posies. A sham defense not as effective as PPE, masking, or even a MERV-13 air filtration system to decrease the risk of viral transmission or of particulate matter. Ashes, ashes, we all fall down. We know in future communicable and climate disasters who will be hit first and worst. Inequity or disproportionate death is unfair, unjust, and preventable. And we know the root causes. We know some joint solutions. May we pursue cross-sector planning and societal level setting of power and resources to build community resiliency so we bounce forward to create a California for all. Thank you.
Thank you so much, Dr. Rohan. Our next speaker is Hazel Davalos. Hazel is the Community Organizing Director at the Central Coast Alliance United for Sustainable Economy, or CAUSE. At CAUSE, Hazel has organized around immigrants' rights, voter mobilization, public transit, environmental justice, education, affordable housing, and youth issues. In her current role, she works to train organizers in grassroots base building through the house meeting model. Thank you again for coming, Hazel. Take it away.
Hello, everybody. Good morning. Glad to be here. Again, my name is Hazel Davalos, and I work with an organization called CAUSE. We're an economic, social, and environmental justice organization, primarily moving our work through community organizing, policy research, and advocacy. And we're based in both Santa Barbara and Ventura counties. Today, I want to speak a bit about the collaboration between CAUSE and the Santa Barbara County Public Health Department, in particular around really collaborating for better working conditions for agricultural workers. And so a lot of this is really tying in how we can treat workers' rights as a public health issue. But given that farm workers are outdoor workers working in crops very much impacted by rising temperatures, whether there's climate change and climate justice really have been woven into our work. Next slide. So at the beginning of our work, we started in 2001, and we've been doing community organizing all along and using the house meeting model inspired by the United Farm Workers. And I remember in my early years as an organizer, we'd hear from workers about working conditions, but really had challenges. We had challenges as an organization to be able to address that because we're a community organization, we're not a union. But in 2015, we decided to take the step to explicitly organize farm workers. And as a start, we set out to conduct surveys amongst farm workers across the region to really get strong data and evidence to prove what we've been hearing all along about violations in the fields and things like that. And so this began through creating the Raising Up Farm Workers report. Farm workers did peer-to-peer surveys, over 600 across the two counties, to get a sense of one, kind of the demographic breakdown of farm workers in our region, and also the prime kind of like labor violations that they were experiencing. And so a lot of what we heard was, working excessive work and overtime. Luckily, that's something that's been being remedied at the state level, and starting in January, farm workers will be getting overtime after 8 hours like everyone else. Just a few years ago, they wouldn't get paid overtime until after 10 hours. Women who had worked in the fields pregnant talked a lot about issues like pesticide exposure. We heard widespread issues around wage theft. So whether not being paid for how many boxes they picked, it's a piece rate sort of labor, clocking in after already starting work, not having breaks, and generally really a culture of fear and retaliation, given that farm workers are one of our most vulnerable workforces, often undocumented, often limited English language ability, but also in our region, we have a large indigenous population, mostly from the state of Oaxaca, speaking indigenous languages, limited access to Spanish, and also literacy challenges. So we took this data and we presented it to our local county board of supervisors to really look at our county government and say, you know what, these labor violations are happening, they continue to happen. There's statewide agencies that are supposed to be addressing these issues, but in a more kind of suburban rural region like ourselves, we're several hours from the nearest Cal OSHA office. We need our local government to step in and do more. And so immediately we launched the Farm Worker Bill of Rights. A quick victory in Ventura County was getting a farm worker resource program, the first of its kind in the state, opened up under our social services department. In Santa Barbara County, we were facing a budget deficit, and instead we pivoted to looking at trying to develop a, I'm sorry, next slide. I'm moving on my own slides, if you don't mind. I'm like 3 slides ahead here. Let's see here. If you want to get me to the one with a bathroom. So, so at that point, we started to collaborate with the public health department in trying to establish a bathroom water sanitation program, really modeled after a program that already was established in Monterey County. And in this regard, basically the public health department steps in and actually takes a role in ensuring hygiene around bathrooms for farm workers, hand washing stations, and drinking water. And so we began work around that. And that was really the first time that we started to collaborate with the public health department around the issue of workers' rights. And so so that started moving. However, then the pandemic hit. And so I can talk a little bit more about some of the work we've been doing during the pandemic with public health. Next slide. So it really early on, we were taking an active role as a community organization to put out information that was really accessible for workers. That's really been a beautiful part of our partnership with public health. We as community trusted, messengers, community organizations have had the ability to put out that information. We quickly realized, like, okay, farm workers working outdoors in the heat. There's laws around how, they're needed to be, they have to be provided shade. But we learned early on in the pandemic that employers weren't providing enough shade for workers to actually be provided shade and be able to social distance. And so that was something we brought to the attention of public health really quickly. And then, of course, the same issues that we were bringing up before all of this around not having adequate hand washing stations was all the more important. Next slide. We also really brought, as a community organization, really eyes and ears on the ground. We also brought to the attention of the public health department about how H-2A guest worker, the H-2A guest worker program in our area means that there's a lot of seasonal workers, mostly from Mexico, living in very tight quarters, often in hotels or sort of kind of labor camp style housing, which really is congregate housing. And prior to some of our talks with public health, that wasn't on the radar as a prime source of congregate housing. And so quickly, that everyone knew about that, including the public, because there was quickly large scale outbreaks in some of this guest worker housing. If you want to go to the next slide. And even in this situation, there was an outbreak in a hotel. A farm worker actually died. However, their employer or whoever put a different address as their residence. And so it wasn't immediately obvious to the public health department that this occurred in congregate housing and that there was indeed an outbreak. But fortunately, because of our collaboration and our connection with statewide agencies, we were able to get that on the public health department's radar as well. Next slide. Also, a great space for collaboration between us and the department throughout this time has been registering farm workers for the vaccine, especially when agricultural workers first qualified for the vaccine. We stepped in really early to do phone banks and sign up workers, especially with limited internet access. We were all concerned about how workers were going to get signed up. And it was great because we already had the infrastructure and the lists and volunteers trained on how to make those phone calls and be really welcoming and warm and answering questions. And so that was very successful. And it was also a really great partnership in that, early on, there was criticism and pushback of our public health department for prioritizing farm workers before teachers, for example, and really having us and other community organizations locally to really have the public health department's back was really, really helpful. Next slide. Another important piece, especially as time has gone on around ensuring more farm workers have been vaccinated, is really putting out the information about the paid supplemental sick time that expired in September 30th, I believe. But we really found as time went on, aside from all the other vaccine hesitation, a lot of it was around workers just being concerned about missing work, whether to get the vaccine or to deal with secondary symptoms. And so we were doing a lot of work to let people know about the access to the sick time and really going the extra mile. We were also creating letter templates for workers to turn in. So we were really finding we would educate workers about their rights, but then they would go and tell their boss, and then their boss wouldn't grant them this time. And so then we'd say, well, put something in writing. And then folks had literacy challenges, obviously access to printer, ability to print out this stuff. And so we were creating templates, giving this to folks, passing them out at their homes, dropping them off. so that people could just hand this to their supervisors. Next slide. And then as far as more of our work focused on sort of climate and disaster response. So as far as like the wildfires and natural disasters, we've definitely had some major wildfires in our region, particularly Ventura County, where, everyone was indoors avoiding the smoke, but you still had farm workers out there laboring, 8 to 10 hours in that smoke. And really we didn't see employers nor the Ag Commission take initiative to stop that from happening. And so many of our volunteers went out directly passing out masks. This was pre-pandemic. And also at one point pushed the Ag Commission to send out sort of a communication to all employers to send workers home. And so this interestingly enough, this may be an area where public health can also flex a bit. We have found with the bathroom water program we've been pushing, public health had a challenge around ability to access the fields, just private property rules, and the County Ag Commission actually had a little bit more of authority in that area. And so there was an attempt to collaborate a little bit more. However, Ag Commissions traditionally are a little bit more tied with industry, but we really found that it was helpful to have public health as a kind of peer, pushing the envelope with the Ag Commission. And to my understanding, this could happen at the county and state level. And so that's just an important consideration when talking about protecting outdoor workers from exposure to smoke and other hazards. Yeah, and so we've also been working on some statewide legislations to provide more protection in that area. Next slide. So as we've looked towards the future of farm worker organizing and also more on this sort of climate resiliency, we've held sort of focus groups with farm workers to really understand how will rising temperatures and climate change impact you as farm workers. And so there's some obvious ones around, higher risks for farm workers around heat illness and things like that. There's also, we have found impacts on wages. And so depending how the harvest goes, especially in piece rate labor, workers being paid less and unable to make ends meet. But we also asked what could be done to prepare, to make life easier for farm workers, especially as temperatures rise and we see climate change. And interestingly enough, one of the key outcomes from focus groups we did was the need for, from like an urban planning or planning perspective, the need to plan for more public cool spaces. And so the thinking was, we're talking with farm workers, we're living multiple families to a home. In our region, most people don't have AC. Folks were saying we need ability like to go to a park, sit in the shade, get away from this heat. And so that's also something we've begun to explore from a planning perspective. Now, all in all, as far as we look, as we look to the future, there was just a statewide legislation signed by the governor's office that will now create a statewide pot of money for any counties who would like to open up a farm worker resource program, like the one that we were successful in getting in Ventura County. And fingers crossed, Santa Barbara County Public Health may apply for that program and open up a farm worker resource program under the Public Health Department. And so this is absolutely, particularly for other counties in agricultural regions, this is absolutely an option worth exploring. We've experimented a bit with a farm worker hotline that our Public Health Department established in July. And basically there's a person staffing a phone number, answering questions about COVID sick time, if workers call with, concerns about their workplace and whether it's safe, and really creating a direct channel of communication between workers and public health, and quickly learning more and more where workers' rights and public health really merge. So that's all I have for you today. I know that was a little rushed in the 12 minutes, but hopefully that was all clear, and feel free to reach out if you would like to know more.
Thank you so much, Hazel. All right, so our next speaker is Dr. Hoi Fei Mak. Faye is the sustainability manager at the city of San Leandro, leading the city's implementation of the Climate Action Plan. and
Zoom
other
meeting, audio button, menu.
sustainability programs. With a strong interdisciplinary background in environmental science, climate policy, and social justice, Faye aims to build out equitable, community-driven strategies for local resilience and agency to climate change in their hometown of San Leandro. Thanks for joining us, Faye.
All right, great. Hi, everybody. My name is Faye. My pronouns are they and them. I will be talking a little bit about some of the community organizing that I've done, as well as some of the local government resilience work. Next slide. So the first case study that I'll talk about will feature the Disability Justice Culture Club. I will be presenting on their behalf as Patrice Westerhand, who's one of the community organizers, wasn't able to make it to this presentation. So I'll be using her slides. Then I'll talk a little bit about some of the informal mutual aid networks and distribution during COVID, and then wrap up with the local government effort that I have supported through Resilience Hubs. And the image that you see here is a watercolor piece that I've done with different mushrooms. Text says listen at the root, as a reminder to really center the community and listening to those community partners for this work. Next slide. So the Disability Justice Culture Club is a collective that centers and is led by disabled and neurodivergent, queer, trans, Black, Indigenous people of color living on the unceded Chochenyo and Lonely Land here in the Bay Area. It was founded by Stacey Park Milburn, who is the center photo in the 9 squares on the right. A dear friend of mine, also a leading disability justice organizer who unfortunately passed last year. The DJCC, as they call it, the tagline is Revolution and Chill, and basically combines movement work, community organizing with relationship building and community building. Next slide. So the grounding of the Disability Justice Culture Club comes from the Disability Justice Principles Framework. Understanding that bodies are unique and essential, that all bodies have strengths and needs that must be met, that we are powerful not despite of the complexities, but because of them. And that all bodies are confined and described by the ability, race, gender, sexuality, class, nation state, religion, and we can't separate them. These are all intersectionalities that we live by. The image that you see here are three of the campaigns that DJCC has run. The first is the Power to Live campaign, which occurred right before the pandemic during the first power outages of 2019, basically highlighting the need for disabled folks to live with electricity. The center photo is a series of COVID care kits that was distributed, which I'll talk about in the next slide. And the third is kind of a social media post kind of describing the support that could be held for disabled folks and asking people to complete a support form. Next slide. So as mentioned, there was an effort to support folks during COVID with various care kits, food, any other needs that people needed. And the screenshot you see here is the Google form that folks had to fill out to meet those needs. This was based off of a volunteer network, so in many ways it's not true mutual aid. The leadership was led by the core organizing team, connecting people, the volunteers to the requesters, relaying that through the resource coordinator, and then connecting into the actual resources. Next slide. So the two photos you see here are some of the care kits that were distributed and a volunteer helping to distribute them. So there were some challenges that they encountered working within and with systems where there was differences in how they approach this work, from a organizing approach versus a volunteer approach. There was also a lot of urgency as there's a lot of needs for disabled and chronically ill folks, particularly in time of COVID, also in the long term, as well as the risk and probability of burnout and conflict with collective work and having many people hold this. But even while they had a lot of those challenges, they were able to make a lot of impact on an individual basis for many disabled folks. And DJCC is seen as one of the leading organizations here in the East Bay, particularly for Black, Indigenous, and people of color, who often get overlooked by other disability organizations. So they were able to connect with all of those different partners and individuals and really continue to build out this connection and support for this work. Next slide. So mutual aid, in the way that DJCC approaches it, has three main components, really helping to meet the fundamental survival needs of the individual or the group, really contributing to building a movement and helping to empower people to participate and help themselves and help each other, and practicing being in the world that we're living, the vision of the world that we want to live in. This service or the help that we give is really no strings attached. There's no stigma for the folks who are in crisis. We're not trying to judge people for the type of needs that they have. There's no kind of eligibility criteria. People are just accepted based on what they judge best for their own bodies. So this type of mutual aid is not hierarchical, it's not transactional, or seen as a way to really save people. Also not a reason for not having wide structural social safety nets. This is not supposed to be the end-all kind of solution, but really to supplement those structural networks. The image that you see here is a air filter building workshop that I helped to organize as one of my community organizing activities that was held in East Oakland as an example of mutual aid, really being able to empower people to both help themselves and help other people. Next slide. So during the pandemic and also before the pandemic, there were a number of different mutual aid organizations and activities that are happening. The Bay Area is really rich in this type of organizing. So even before the pandemic, there was already wildfire season mass distribution through organizations like Mass Oakland, Berkeley Mutual Aid Network, Asian Black Lives, and so on. And then when the pandemic hit, that expanded out to food distribution, COVID sanitation kits distribution, and so on. The screenshot you see here is of a Google spreadsheet that was spontaneously created in the early days of the pandemic, where people listed out both organizations that helped to meet people's needs, as well as individual requests for money, for food, for things that all of a sudden people were losing their jobs and so on. So that was distributed through kind of word of mouth, as well as through different community-based organizations for this types of distribution. Next slide. So with all of that, from the community side, on the local government end, Resilience Hubs is a way for us to support all of that. So resilience hubs was a term that was coined by the Urban Sustainability Directors Network, or USDN, and basically just describes all that type of community organizing, community building that those organizations have done, where we as local governments support those organizations to augment their work, to continue to support residents, to continue that kind of communication, resource distribution, empowerment, and so on, with the understanding that those community-based organizations are best suited to do that on the ground work because they have their existing relationships and networks that oftentimes we as local governments would be very, very hard for us to reach those populations. So rather than us trying to reinvent the wheel, we would then kind of shift power over to those organizations or individuals to do this work, and we would provide technical assistance, infrastructure, funding, resources, and so on. And this image you see here is kind of an idyllic illustration of what that could look like with a park, people playing, a community garden, solar panels, EV charging. So something that could be a resilience hub. Next slide. So over the course of this past year, San Leandro collaborated with a number of other cities, as well as NorCal Resilience Network, to build a Resilience Hub leadership program. And the idea is that we would build the capacity of different community-based organizations to learn what it takes to meet some of these climate needs, kind of shift and reframe what they were already doing, and connect to different resources and funding that we as local governments could offer. So the government training was held in January 2021 to cover what this would look like from local government and the role of the agencies as listening partners to be able to shift the power over to the community-based organizations. And then the program kicked off for the rest of the participants with monthly trainings and skill shares for 275 participants, including 49 government staff. And the image you see here is all of our happy faces at the first kickoff meeting. Next slide. So there are a number of outcomes and benefits that we had from this 1-year pilot training. So there was a lot of relationship building that happened between the agencies and the community-based organizations. This was an opportunity for us to get to know a little bit better what those community-based organizations were doing within our jurisdictions, and for us to support them in this work and to build that partnership. There was also an identification of those community sites that were ready to implement a climate action, either in programming, in services, in infrastructure, and then we could then, on the local government end, start identifying what they needed in order to move forward. This was also an opportunity for capacity building, both for those organizations and individuals around climate action. The training covered everything from emergency management to solar energy, gardening, water harvesting, and so on. So there's a lot of different topics that folks could tap into. And then lastly, this is also a practice of active listening by those local governments who participated to really learn from it and identify the needs from the community-based organizations, as in many of the places that participated, there was, as mentioned before with Dr. Rohan, that historical kind of racial injustice that's been practiced through local governments. So this, by active listening and really shifting the power, we're starting to shift the way that we can heal from all of that and move forward. Next slide. So with San Leandro, after this training program, which ended in September, we are moving forward with providing technical assistance to the Resilience Hub sites that participated. There was a handful of those that that participate in the leadership program, and they're also moving forward with trying to implement certain actions. So with a Civic Spark Fellow working this financial year, we're able to help them to connect to different funding, to help them to do a site assessment, to help them to plan programming, and so on. The Civic Spark Fellow will also be training or leading trainings and workshops for other interested community-based organizations who weren't able to participate in a leadership program, but also have different immediate needs around heat waves, power outages, and other things, as well as recruitment of other potential sites. And the image that you see here is of an outreach workshop that I did a couple of years ago with translation by the school district around climate action. Next slide. And then just as the last slide, I really see that local resilience hubs is a way to bridge the community and local governments. The table that you see here is that the community-based organizations have deeper relationships and trust, as well as the network, as well as a deeper understanding of what the local needs are, and they can mobilize faster to reach those hard to reach frontline communities. What they need on the right side is more resources, more funding, different types of infrastructure upgrades for their particular sites or properties, as well as guidance on what would actually make them more climate resilient. And all those things are things that we as local governments can help them with in various ways, either pointing them to funding opportunities, giving technical assistance to applying for that funding, or guiding them through how to do infrastructure upgrades and so on. So this type of partnership is a model where local governments can step in to support what's already happening, that type of both formal and informal mutual aid that is going to be able to help meet those needs and be able to address different crises, whether it's climate, COVID, or whatever else is coming our way. Next slide. I think that is it. Yep. All right. Thank you so much.
Thank you, Faye, for that presentation. So moving on, our next presenters are Dr. Shasta Gon and Angie Hacker. So Dr. Gon is the Environmental Director and the Tribal Historic Preservation Officer for the Pala Band of Mission Indians in Pala, California. She's worked for the Pala since January 2005 and established the Tribal Historic Preservation Office in 2008. So Dr. Gon also oversees the Tribal Climate Health Project, a grant-funded education and outreach project that provides resources on climate change and health adaptation in tribal communities. Angie Hacker is a principal consultant and CEO of Prosper Sustainably, a women-owned California-based firm providing energy, climate, and environmental consulting services for communities and the organizations that serve them. Thank you for joining us, and take it away.
Thank you, Dan. Appreciate the introduction. And again, my name is Shasta Gon. I am coming to you today from Payum-Cowichan lands in the place the colonizers named San Diego. We're on the Pala Reservation. Most people know the people here by the names Luiseno and Cupeño. And I am happy to be here with my colleague and consulting partner, Angie Hacker, who is going to be taking on most of this presentation. I just want to give you a little bit of background on Pala and the work that we're doing. We developed the Tribal Climate Health Project with a variety of funding sources, but the primary funding comes from the Bureau of Indian Affairs, the BIA, from their climate resilience program. And the point of the Tribal Climate Health Project is to develop tools and resources that different tribal communities can use to help them inform their tribal climate vulnerability assessments and their climate adaptation plans. And we call it the Tribal Climate Health Project because it has a focus on health, which we found is not always addressed in vulnerability assessments and adaptation plans. But as we're hearing from our presenters today, there is an important health component, not only obviously to things like COVID-19, but to our climate planning, because the health exposures or the impacts from climate change can end up having an impact on people's health. When the COVID crisis happened, we realized that there was a lot of overlap between what we had learned in our climate resilience work and health, and could apply the lessons of COVID and the lessons of climate change to both of those things. Here in Paula, we found that, again, a lot of the same indicators that were leading us to adapt to potential public health emergencies, we could implement those in terms of our COVID response. And it led us to some particular strategies in terms of things like our public outreach to help people understand the impacts on their health of climate and then now of COVID. So putting together what we learned and then looking around at other communities throughout not just California, but the United States, we developed, mostly with Angie's leadership, a climate and COVID paper, and that's what she is going to present on for you now.
Hi, good morning, everybody. Thank you so much for having Shasta and I here today on behalf of our work at the Tribal Climate Health Project. Again, Angie with Prosper Sustainably. I'm based on Chumash lands here in Carpinteria, California. In my work with tribes on climate change and health adaptation during the pandemic, it was very clear very early on that tribes were being disproportionately and uniquely affected by COVID, and that there was an obvious intersection with climate change. Most immediately, the economic effects of the lockdowns on tribes meant that suddenly already overwhelmed tribal serving professionals were working under very uncertain circumstances, pulled away from their duties, playing multiple roles, working on mission critical, and things like climate change sometimes took a place further back on the back burner. At the same time, I was getting blown away witnessing the speed at which new important response practices were being developed at Paula and other places to respond to the pandemic, and thinking, oh my God, so many of these are helping us with our climate adaptation work and could be applied that way, since both were leading to these massive scale health crises. So, you know, as the climate economist Gernot Wagner noted recently, the pandemic is, in a sense, replicates climate change at warp speed. So it's, you know, it was overwhelming everybody with all of the disruption, but it seemed like no one really had the capacity, time, mental, emotional capacity to look at it that way. And so we wrote a paper about this intersection, and it was released in June thanks to funding that we got from the NIHB, National Indian Health Board's Climate Ready Tribes program. And I want to thank Serena Soar, who's also here. She's gonna, she helped me with the paper, and Chess as well, and she's gonna link it in the chat. We weren't looking at any causal relationships between climate change and pandemics, but we were looking at how the lessons, examples, and experiences from one crisis can inform the other. And to gather that kind of information from tribes, we conducted a survey, held remote conversations, we reviewed existing literature and recordings from all sorts of places, even congressional hearings. We basically used what we could find. What we found is that while tribes were generally feeling very unprepared for this crisis, that they have risen to new challenges in taking care of their communities in a variety of ways. We're going to talk about some of that today. And so really think of this paper more as a collection, a snapshot, a collection of examples rather than a representative sampling. I do want to take a moment to thank those that contributed to the paper, but also just take a moment too to acknowledge that U.S. tribes have really demonstrated diligence and endurance both against COVID and climate crisis, and I just want to acknowledge their ongoing loss and grief. So how the paper is organized, the paper first describes what we learned about tribal COVID experiences, which were grouped under 5 categories that you can see on the slide on the right. I'm pretty sure that's up, yep. And, you know, it was an extension of existing disparities, things like underfunded medical services, lockdowns hit already strained livelihoods very hard, COVID trauma, compounding historical trauma. And then we moved from learning about the experiences into providing, learning about examples of how tribes responded to COVID and trying to apply those examples to climate emergencies. And that's what we'll really spend our time on today. But I do want to mention that it was really clear in what we learned that tribal leadership proved that it can be proactive without having to be at the mercy of federal or state agencies. So a lot of what we looked at was how tribes are protecting themselves. And big conclusion was that the report posits that these lessons and practices, where continued, fortified, systematized, or replicated, can generate greater tribal resilience for future climate emergencies. But that would take work. Capacity continues to be constrained. But on the next slide, let's go ahead and look at some examples. So we categorize the tribal COVID responses into 7 categories, and those are on the left in the diagram. That's the Venn diagram. That's really just showing that many of the practices can also apply to the climate crisis. What I'm going to do here is just dive right into 6 practice areas. Some examples that we found under 6 practices. So the first one is around emergency planning. So during COVID, we saw new urgency to develop and improve emergency plans, equipment, and sites and facilities to manage the increasing pressures on emergency responders. Sometimes that looked like repurposing unused office space or hotels into storage centers or shelter or even temporary housing. And we also saw, in doing that, they were simultaneously increasing capacity for climate events. So the LUMI Nation in Washington bulked up their emergency plans. They gathered test kits and personal protective equipment and storage systems in preparation to open a field hospital for COVID-19 patients. Paula, Shasta mentioned, coordinated its departments into an emergency response committee. It's building out its climate hazard. It did a climate hazard mitigation plan and has a new emergency operations plan being developed. Those are both incorporating pandemics and climate hazards. And just to mention, the intersection there with climate change is probably obvious, but more and more we're seeing communities start incorporating infectious disease planning, and that can help tribes better respond to outbreaks in vector-borne disease, waterborne disease, and things that are going to be expected to become greater threats due to changes in temperature and rainfall patterns. The Gallup Indian Medical Center in New Mexico worked to convert 4 Gallup hotels into respiratory shelters for those needing to quarantine who may have been exposed to the virus, prioritizing people who were homeless. So quickly being able to develop shelters. And then there's this might seem like an off topic, but the Tribal Broadband Connectivity Program got a huge infusion of money, another $1 billion to deploy broadband infrastructure, affordably across Indian country to lessen what they call the digital divide. And it became important because what we learned in a workshop with tribes back in April is that the pandemic revealed that it actually was possible to communicate and work remotely through a variety of digital platforms. Not all work had to be done in person, but the ability to shift to the digital communications was not as easy for some as it was for others. Some tribes really had a difficult time. Some of them actually set up centralized Wi-Fi areas where folks could come and just work in their car in the parking lot because it was the only place they could actually access broadband. But those tribes that did can tap into the enormous infusion of this broadband funding can be better prepared for an increasingly digital future and for the climate events that probably are going to continue to limit travel, require sheltering at home, or necessitate access to emergency information and services. And then as folks are developing these emergency sites, we're seeing more interest in developing sites that are thinking about power resilience, incorporating microgrids to ensure that community has access to cooling, air filtration, electricity for electricity-dependent medical equipment, and communications in the event of a central power grid going down. And then there's other things like processes and protocols for key emergency operations and orders like checkpoints, curfews, shelter-in-place orders, food distribution, call center activations, work from home criteria that can be used in other types of disease, flood or fire management, fire disaster management. So if tribes have a unique level of authority to be more cautious in some cases than their state or local neighbors, or to work quickly or at least on their own pace. So at Chickasaw in Oklahoma, swift action by the governor to declare a state of emergency closed all non-essential businesses and offices and led to safety, screening, testing, contact tracing, epidemiological surveillance, a lot of different environmental controls, and a data-driven approach that really was successful in lowering COVID infection rates comparatively. At the same time, we saw the federal USDA food distribution program had a program that was actually was partnering with tribes through the CARES Act funding to coordinate free food events serving tribes and non-tribal jurisdictions across the country. But thinking about those, familiarity now between the coordinating with the federal agencies on food distribution, these tribes are now maybe set up, if they were to develop a protocol, set up more easily the next time if there is a climate disaster, they can set up food distribution. The Barrington tribe in Nevada received biweekly water delivery during the pandemic. So obviously water delivery could be an issue during any kind of climate event. But the point being that tribes can set up protocols to more easily get these kinds of services up and running during climate events. And then another example is that tribes serving entities are also establishing telehealth services for physical and mental health for when in-person appointments are just not possible. So that was obviously true during the pandemic. It will be true during things like a flood or fire, any kind of transportation closure. So in Arizona, the Tuba City Regional Health Center responded quickly by developing a nurse hotline for people to call with COVID-19 symptoms. They reassigned staff and set up virtual visits for high-risk patients. They had a drive-through clinic for pediatric vaccinations. So they were able to quickly transition over to different types of services that didn't require in-office visits. And then advances in digital technology had made it possible for programs like the Indian Health Service's telebehavioral health program to increase its mental health protective measures in tribal communities. So we're seeing both mental and physical telehealth services. Next slide, please. And then we're also seeing things like formalizing consortia between tribes and agencies, other agencies for healthcare. Tribes with the capacity, we found capacity to manage their own health services were able to offer faster and more reliable medical services like testing and vaccines, but it isn't a hard leap to understand why having control of your own medical systems could be very helpful in a climate disaster and being more nimble. And if you know anything about how the funding for Indian Health Services is offered, it's a big deal to be in control of your own health services. So the Chickasaw Nation took ownership over its medical services years ago, actually, but it opened one of the biggest hospitals in the state, which allowed for additional capacity during COVID for life-saving treatments for tribes across the state. So they were able to serve tribes across Oklahoma. And then another example is just, data, developing real-time data to surveil and communicate community threats and impacts. One example was at the Muckleshoot tribe in Washington. They were able to coordinate amongst tribal GIS, emergency services coordinator. They created a community survey and a certain app, and they were basically able to provide leadership and early baseline condition assessment of the community's health. We're also seeing a lot of examples of things like public data dashboards. All those kinds of things can be very helpful in a climate emergency, or even just as climate conditions change and worsen. Finally, just one last example here is just developing culturally informed outreach practices can help to address misinformation, which tribes saw a lot of, like the rest of us did, relaying critical information, emergency information, and ensuring that the most vulnerable are properly protected. And one example I really liked was that the Wabanaki Public Health Department in Maine adapted a strategy from First Nations tribes in Canada called the Colored Paper Project, where they basically asked elders to put up a colored paper signifying how well they were doing and if they needed help. So a certain color would be placed in a window if they needed help. And they had caseworkers available to go provide immediate services for folks that had a certain colored paper up. That's the kind of thing you could see used in a flood or a fire. So in closing, a journal article recently stated a stable climate is the most fundamental determinant of human health. That's a huge statement, and I keep saying it over and over. It's more than poverty, it's more than conflict, it's more than a pandemic. But I am glad to see that the pandemic elevated the role that safeguarding public health can play in maintaining a functioning community and economy. So we're seeing tribes really increasingly recognize the need to respond to these growing vulnerabilities and COVID being an opportunity to leverage resources to strengthen tribal resilience for more than just pandemic response. And so with that, I'll just say, one way that we have found that folks can honor the losses and is to take the time to learn what we can and best capture these new opportunities so they can be prepared. Tribes can be better prepared for the next disaster by fortifying these practices where we can. Capacity is still constrained, and that's probably an area where the Tribal Climate Health Project, the state, and others can help provide support. Thank you.
And I'm just going to add that I put my my email address in the chat. It's not quite right on the slide. It should be sgon@palatribe.com. If you send it to .org, I will not get it. And just also to follow up that very much similar to the other presentations we've seen today, one of the other things we already knew before COVID, but that COVID helped make even more clear, was that tribal communities have a lot of social justice and inequity and inequality issues that they've been dealing with for centuries under the impact of colonialism. And so we definitely see connections between what's happening with, for example, the farm workers and some of the conditions that we're seeing, especially in the more rural tribal communities. Paula's not particularly rural. We're close to San Diego and Riverside. But I think everybody heard in the media what was happening with the severe case rate of COVID on the Navajo Nation. So there is a lot of work to be done, and we're grateful to have this opportunity to not only share our work, but to hear from others. So thank you.
Thank you so much, Shasta and Angie. Really appreciate that. We'll be taking just a very short break. Thank you so much to our interpreters, just to give them a little bit of rest. And so we'll plan to start things back up maybe closer to 11:39, let's say. So we'll take a break right now. Thank you again for joining, and continue to feel free to put in your questions in the chat, and we'll catch you in a few minutes. Thanks. All right, so let's jump into the last few speakers. So next up, we have Matt Vanderslice in Savannah North. So Matt oversees the policy change efforts of the Bay Area Regional Health Inequities Initiative, or BARHI, which is a coalition of the Bay Area's local public health departments focused on health equity. He brings nearly 20 years of experience shaping inclusive public policies and plans at the local, regional, and state level. Savannah North is the Climate Resilience and Health Equity Manager with the Public Health Alliance of Southern California, where she works on advancing community climate resilience and justice in partnership with local public health jurisdictions, community-based and environmental justice organizations, and other partners. Prior to joining the Alliance, Savannah worked with the Center for Climate Change and Health, providing support and technical assistance to local public health departments across the U.S. Take it away, Matt and Savannah.
If my slides are queued up first, I'm happy to start. Wonderful, thank you. Good morning, everyone. As Dan said, my name is Savannah North. I use she, her pronouns. I'm the Climate and Health Manager with the Public Health Alliance, and I'm joining this morning from Maloney Land. Thank you very much to CDPH Office of Health Equity Climate Change section for the opportunity to share some of our key lessons learned over the last several years and priorities elevated throughout the COVID emergency that can be applied to the climate crisis. I also just want to quickly thank my fellow presenters for their incredible work and leadership on these cross-cutting issues and opportunities. Next slide, please. Very briefly, for an organizational introduction, we're a coalition of the 10 local health departments that represent over 60% of the California population in Southern California. We focus on policy and systems change across various issues, including climate change, health equity, birth equity, and really strive to mobilize the transformative power of local public health to advance these goals. Next slide. We are also the developers of the California Healthy Places Index, which was used for the COVID health equity metric several years ago in response to data needs and gaps elevated by our local health jurisdictions, as well as community partners and others. Our organization, in partnership with many stakeholders, developed the California Healthy Places Index. HPI provides hyper-local data at the census tract level and beyond to really look at vital community conditions that help illuminate the root causes of inequities across the state. And HPI is unique in that it is an index that's correlated with an important health outcome, life expectancy at birth. Next slide, please. And with that kind of brief organizational background, I want to share some of our key lessons learned over the past few years. And given our brief time together this morning, I want to focus on 4 key areas: building local health jurisdiction capacity, enhancing community resilience, local and state policy action, and enhancing data practices for equity and climate action. Next slide, please. Before delving into the specifics, I also want to share a very brief background on some research that we've conducted over the past 2 years related to the local health jurisdiction COVID response to communities facing the disproportionate impacts of COVID, as well as climate impacts. We conducted surveys in real time with local health jurisdiction leadership, data experts, and community-based organizations to really understand the evolving barriers, response strategies, as well as emerging ideas for a just recovery. Additionally, we conducted key informant interviews with our local health jurisdictions, and a quick shout out to BARHI and the San Joaquin Valley Public Health Consortium, who also interviewed their members to inform this sort of full scope of information. And data from the surveys and one-on-one interviews really helped us as an organization and a sort of partnership space to understand the key challenges, best practices, as well as the priority areas that are largely informing sort of the points that I'll share today. Next slide, please. So to begin with sort of the first critical area here, the importance of investing and expanding the local health jurisdiction workforce and capacity through investment in our local public health system and state public health system overall in a holistic way. So a few strategies to accomplish this that I want to highlight are increasing in categorical funding that will enable local health jurisdictions to develop a cross-cutting workforce and programs that can really address climate change in conjunction with these other health issues and equity issues that we know all intersect. Another critical strategy is to shift recruitment, hiring, and retention strategies to really build and support a community-based public health workforce that is more reflective of the communities that are served by our local public health departments and other agencies. Another essential strategy is to invest in supporting and expanding networks of community health workers in coordination with local health jurisdictions. That might look like providing training programs, reducing barriers to entry, and increasing access to living wage jobs. We've seen the critical importance of community health workers both prior to, obviously, and throughout the COVID emergency. And we really see this expertise in community relationship and rapport as a needed expanded strategy to really build community climate resilience through education, home health assessments, access to resources, and community organizing to really drive community solutions to climate impacts. The other core strategy that I want to quickly touch on is ensuring that our local health jurisdictions are optimally positioned to support and collaborate with communities in the face of climate change by making sure that equity is really embedded in the structures and practices of local health jurisdictions. And a few specific examples of how our members are engaging in this effort is through the Alliance's Regional Health Equity Work Group, which includes equity representatives from across the region, all working on strategies to build organizational capacity to advance health and racial equity. The work group specifically works to advance the goals and priorities that have been outlined in our Regional Health Equity Action Plan, which includes a specific priority related to climate equity. The other recently launched strategy is the Alliance's Regional Equity Learning Collaborative, which is an inaugural 2-year cross-departmental public health collaborative among our local health jurisdictions in Southern California. And it really brings together public health leaders working across disciplines, including epidemiology, health equity, environmental health, health education, among others, really with the goal of peer learning and co-creating solutions to the most pressing equity challenges, including climate change and racism. Next slide, please. So the second key priority I want to elevate is the importance of enhancing community resilience and local health jurisdictions supporting those efforts. So this, the two key things I want to highlight are funding CBO partnership networks that are coordinated with local health jurisdictions to really leverage shared capacity and expertise, and really reframing practices of short-term project-based transactional relationships with community partners to long-term sustained transformational partnerships that are rooted in sharing power and decision-making. One example from the COVID emergency that is a promising practice is the Together Toward Health model, which has supported funded community networks responding to the unique needs of impacted communities. And I just want to note, as Hazel described in her presentation, there really is incredible benefit and power in mutually supportive community-based and public health partnerships to protect the health and rights of communities that are disproportionately vulnerable to climate impacts, to the COVID emergency, and other health and equity challenges. The other critical component is really supporting and advocating for community-based and community-derived solutions. As Faye described earlier, the community resilience hubs, which have really been championed by many of our environmental justice and community-based partners across the state, are a critical strategy to really support community self-determination and the needed services in community spaces. And these are the types of strategies that we within the public health space and local public health jurisdictions need to be supporting to build community power, climate resilience, and overall community resilience to different shocks and stressors. Next slide, please. And to provide some pretty high-level recommendations related to local, state, and federal policy changes as well, I want to point to the importance of looking at changes in the policy process to advance climate action, health, and equity. And some of these process changes should include embedding strategies to address racism as a public health crisis throughout the policy process at all levels, supporting community-informed policy priorities at all levels as well, including how community is able to participate in and access the policymaking process. Additionally, I think it's critical to really institutionalize the use of a health equity framework, including the development of health equity metrics in ongoing policies and investment and resource allocation decisions related to climate mitigation, adaptation, resilience in particular. As it relates to some of the needs and short-term priorities learned from COVID that need to be applied to climate emergencies from a policy perspective, the importance of assessing the efficacy of the short-term local and state policies that were enacted to support essential and frontline workers related to food assistance, paid sick leave, eviction moratoria, et cetera, to really determine where were the shortcomings, but also what are the best practices for future climate-related and other emergencies, so that those stopgap and basic need policies can be instituted rapidly. Additionally, the importance of conducting a comprehensive review of emergency assistance funding sources at the federal level in particular, and work to advocate to remove eligibility restrictions when these restrictions prohibit individuals from obtaining resources needed during a climate or other emergency. We also see a key lesson learned is the need to expand access to resources and protections needed to meet immediate social needs during a climate emergency. The other key lesson learned that I think is cross-cutting across any type of emergency, whether short-term or ongoing, is really focusing on long-term upstream strategies to advance health equity and racial justice through improving economic, housing, and food security, which, as we all know, are really fundamental to supporting community climate resilience as well. And just to draw attention to a few examples, universal basic income pilot projects. There's also a really powerful example out of San Francisco called the Abundant Birth Project, which provides cash supplements to Black and Pacific Islander pregnant people, really as a strategy to both reduce the short-term health impacts of preterm birth, but also improving economic outcomes for these communities, which ultimately increases community resilience to climate change as well. Next slide, please. And the sort of fourth key point here that I want to elevate is the need to enhance data practices for climate resilience and health equity, really by applying lessons learned from the COVID health equity metric to climate data and impacts. So a few specific examples very quickly are extending the small area methods used for the health equity metric to heat health outcomes. So that looks like geocoding heat deaths to census tracts and really looking at rates by HPI quartiles, and then prioritizing resources to increase resiliency and prevent heat illness. Additionally, the importance of continued disaggregation of data by race and ethnicity, sexual orientation and gender identity, and other demographic characteristics that will ultimately support improved allocation of resources, programs, and inform collaborative efforts with CBOs. Next slide. Wonderful. And just to flag this, I won't go through it. There is an upcoming HPI update that should be released early next year with additional updated data as well as new functionality. And with that, in the next slide, I'll end here and pass it to Nat. Thank you very much.
Fantastic. Hi, all. This is Matt Vanderslice, the Director of Policy for Bar-High. Next slide, please. Bar-High is the Bay Area Regional Health Inequities Initiative. We're the coalition of the 11 local health departments of the Bay Area, focused on addressing the decade-wide disparities in health outcomes based on race, income, neighborhood across our region. We're focused on transforming public health practice to eliminate health inequities using a broad spectrum of approaches that create healthy communities and economic prosperity for all. And we've been deeply involved in advancing an equitable response and recovery from COVID-19, as well as addressing a health equity agenda for climate. So I'm going to take a few moments to share some lessons learned from that process. Next slide, please. So during the pandemic, we've come out with a series of really powerful tools and guides to help local governments in the Bay Area advance health equity and shared economic prosperity in their approach to the pandemic. And I think a lot of the big ideas from those tools are really relevant to the climate crisis broadly and climate-driven disasters specifically. Together, they form a toolbox that helps shape the policy, practice, and investment decisions that government entities need to make. Some are broad-based and some focus on specific high-impact strategies. So in the summer of 2020, we released our response and recovery platform, which highlights 4 big areas for action and identifies key populations, makes it very explicit about the need for prioritizing Black, Latinx, Pacific Islander, Native American populations as key populations to drive and wrap responses around. Next slide, please. This summer, we came out with our COVID-19 Equity Investment Guide that identifies key investment priorities. And why I think this is particularly important is because, you know, they say the distance between dreams and reality is action. And I think right now, actually, that distance is investment. And we're in this moment of unprecedented government investment and decision makers racing to figure out how to spend it. It's unprecedented, but it's what we're going to see for our next climate-driven disasters. There's going to be a huge infusion of cash. We'll need to figure out how to spend it rapidly. We need models and tools so that we can spend those dollars in the highest impact ways to advance equity. So this could be a model for investment frameworks for when there's a sudden infusion of cash after the next climate-driven disaster. Next slide, please. These are some of the principles that anchor this guide. Next slide. Next slide, please. So to drill down to 2 other tools that I think are really exciting, one of the most important strategies we found during the pandemic is having an equity officer and a supportive unit in place in the emergency response structure, in the emergency response protocols, in the room where it happens, where decisions are being made rapidly during a disaster. We've had examples all across the region where an equity officer was in place who was able to drive equity into those decisions. Contra Costa County, the chief equity officer was able to get testing going to equity communities. San Francisco, they were able to partner really closely with the health department to notice racial disparities, one of the first in the country. So we've been lifting up this model for use in COVID as well as climate-driven disasters. We had an amazing webinar with Dr. Radhakrishna earlier, and we have a community of practice of equity officers here in the Bay Area. Many thanks to CDPH for lifting up funds to support the establishment of equity officers. It's a really important down payment for a transformation in our public infrastructure. Next slide, please. And finally, we've seen how important it is to have planning processes for disasters, for resilience that center equity communities. So we recently came out with a really exciting guide about ways to do that, both structural changes and tips and tricks for practitioners. Next slide, please. It's got fantastic perspectives from community-based organizations about how they need processes anchored around their needs. Next slide, please. And we capture a lot of these ideas in a piece for the Kresge Foundation. You can see the link here on the screen that really explains in depth the power of equity officers for climate-driven disasters and of community-centered planning processes. Next slide. And with that, excited to stay in touch with all of you. I've learned so much from this community. Look forward to being able to support you all in the future. Thank you.
Thank you, Matt and Savannah. So we're running a little bit behind, but we have one more presenter coming up. So it's our last presentation. Dan Petticord is with the Contra Costa County Health Services team, previously served as Director of Public Health, and is now in a new role as the department's first ever Climate Change and Health Policy Officer. Thank you so much, Dan, and I'll turn it over to you.
Thank you, Dan. Can folks hear me?
Yes.
Good. So good morning. While we have 1 minute left of the morning, I was asked to focus on our journey to prioritizing climate change as a local health priority for our local health jurisdiction. And so next slide, please. One could say we started that journey about 165 years ago when Eunice Newton Foote discovered that CO2 in a bottle warmed to a higher degree than air, and published her research a long time ago. Next slide. Fast forward to today, and we have an unprecedented global declaration that climate change is literally the single greatest threat to global public health. And I love how Sarah Zimmerman frames it, that if we don't address climate change now, nothing else will really matter. Next slide. And so again, just to frame our work a little bit more, we work to endeavor to better understand exactly how global warming and sea level rise will be impact us here in the Bay Area. As you can see, we're anticipating as much as an 8-degree Fahrenheit increase by 2100, and in a worst case scenario, up to a 10-foot increase in sea level by that same time period. Next slide, please. And so all of that was really preceded what we did about a year ago, where our Board of Supervisors declared a climate emergency. And then a year later, just this past September, our Health Services Director, Anna Roth, really stepped forward in a big way by creating the new position that I am very fortunate to be in at this point in time. And really recognizing that global climate change is the preeminent threat to public health. And then here just a couple of weeks ago, our Board of Supervisors allocated $3 million from a recent tax measure called Measure X that will go towards sustainability efforts. A good bulk of that initial money will probably go towards electric vehicle charging stations. We've done a lot of work in the past several years to put in the infrastructure for solar panel recharging in many of our facilities. Next slide, please. And so I think just to reiterate what we've heard over and over again today is that the impacts of climate change are going to be horrifically inequitable. And one of the ways that I look at framing this is that the risk of harm is a factor of both exposure to climate change and vulnerability. We've talked a lot about the different social, economic, and racial vulnerabilities and inequities that are embedded in all of that. Next slide, please. And this is an excerpt from the 4th National Climate Assessment done in 2018, which just continue to reiterate what we say over and again, is that particular communities of color, will be horrifically overburdened from the effects of climate change. Next slide. So a few of the things that we're doing, just to bring this back to some practical things, and this is sort of a lead up to where we have taken off in September of this year. We had formally launched a Green and Healthy Homes initiative. This is really a partnership between our Department of Conservation and Development, or the Planning Department in many counties, and a number of our health providers, including our regional medical center, our health plan, and our public health division, where we go into homes, we do an assessment for asthma triggers and risk, and we use some of this grant funding to help mitigate those triggers. We are launching a green business plan. We've actually had one for a number of years, really embedded in our hazardous materials division. With that division also did a sea level rise threat inventory to local industry. We are the second most industrialized county in the state, second only to Los Angeles. We have 4 active oil refineries in our county. Over the last several years, we've developed an excessive heat response plan, a wildfire smoke response plan, a public power safety shutoff response plan. We were one of the departments, that our health service department, along with our social service department, that opened as resilient centers during the 2019 and 20 public power safety shutoff events. One of the more exciting things that we are very actively engaged in is a refresh to our county general plan and working diligently to embed public health concepts and measures, actually human health output measures, into the general plan. And I think this particular conference we're here now is reminded me to also embed a number of equity metrics into the county general plan. As an addendum to our general plan, we're also updating our county climate action plan, and all of that has led to the creation of an interdepartmental climate action task force that we are actively participating in. In fact, we're on the steering committee for that. Next slide, please. Next. So our climate agenda, and it is an evolving one at that, is, and I think you've heard this several times today, is to pursue a framework of health, equity, and climate in all of our policies. As I mentioned before, we'll be pushing a green business plan for all of our Contra Costa Health System operations. You've seen some things in the media recently that attribute somewhere between 6 to 10% of global greenhouse emissions to the health industry at large, and about 60% of that is driven by the products we procure. Again, I mentioned that we'll be contributing hugely to the general plan and the climate action plan, and we are in the process of forming a climate champions group of staff. We are going to call this the Green Government Group. And next slide, please. But most important for us in public health is really to frame everything around climate around social, racial, and environmental injustice. And again, just reminding ourselves that risk is a factor of both exposure and vulnerability. And we are going to work hard with others, including our Chief Equity Officer, to lift up community voice in the process of working directly with communities around mitigation, adaptation, and resiliency strategies. We intend to be an active supporter of a variety of regional efforts, working with the Bay Area Quality Management District and CARB related to clean air and greenhouse gas reduction. We have a very active initiative going on around AB 617 out in the western part of our county currently, and hope to bring that to the eastern part of our county in the next evolution of that. And we recently are dipping our toe into being an active supporter of a number of regional academic-centered climate research activities. Next slide, please. And so I think we're just ending with this, is that the real injustice of human-driven climate change is that those who have contributed the least to greenhouse gas emissions are tragically the ones who may well suffer the greatest inequities from global climate change. And that's true injustice. And then the overaccumulation of greenhouse gases has put the planet on a collision course with global warming that, if left unchecked, is likely to have profound and ever-increasing impacts on health and equity and social well-being. And I think that's the end of my presentation. Thank you.
Thank you so much, Dan, and appreciate your presentation. And apologies for our going over noon. For the interpreters who need to finish up, you're definitely welcome to wrap things up. Just a final comment to close out the meeting. Thank you all for joining us, and for all our amazing speakers for their insights about how equity practices that emerge from the COVID response can and are being applied to challenge racism, advance health equity, and build resilience to the impacts of climate change. Thank you as well for our interpreters and captioner, and to all of you for joining today. And a reminder that our recording will be posted in about a week The URL should be in the chat. We'll also send it out after the meeting for all registrants. Thank you again. Take care, stay healthy, and have a good rest of your day.